you've got the basics of transgender identity down.
Well, I guess now I know how important it is to offer a friendly environment for my patients. But yet still, I don't know how to help transgender people transition.
Well, getting these looks ain't easy. I'll tell you about some non-surgical options. Remember, not all your patients want to or can afford to make this transition.
So HRT basically stands for hormone replacement therapy. It's the same terminology that we would use for cisgender patients who have gone through menopause or who have androgen decline that's associated with aging. We replace the hormones that are supposed to be there. When we speak about patients who were assigned male at birth or patients who wish to feminize, we would be speaking about administering exogenous estrogen, sometimes progesterone, and also giving an agent that will block the effects of testosterone, which is a very potent sex hormone.
If you still have testosterone in your system, there's very little effect from the feminizing hormone. So we give a blocker in the form, in South Africa, usually of cyproterone acetate or spironolactone. I usually start with spironolactone because you can go smaller dosages and you can titrate it up slowly but surely. And then for the feminizing effect, we use estrogen.
So if the best thing is available, it would be estrogen patches, because the risk for deep vein thrombosis is much lower with that. The second safest thing would be estradiol. If that's not available, then conjugated estrogens does have a risk of deep vein thrombosis, but if that's all that's available, it can still improve people's lives.
So these here boost estrogen. Seems pretty straightforward. What are the effects?
The irreversible effects of estrogen predominantly relate to breast development. Once breast tissue has grown, it may fluctuate in size, it might get bigger, it might get smaller, but it's not going away without outside interventions. That would mean surgical removal. The reversible effects of estrogen include body fat redistribution, so the development of hips and bum and slimming around the abdomen. That fat basically moves into areas that we would associate with secondary sexual characteristics of cisgender women. Body hair generally becomes less coarse, less thick, less prolific. Facial hair also becomes thinner, but it will not disappear completely, and the changes to occur are slow. So it's very unlikely that facial hair would disappear simply under the influence of hormone therapy. Often external interventions such as electrolysis or laser hair removal would be necessary in order to completely eliminate facial hair. As for the voice, the vocal cords are muscles like other muscles in the body, and when an individual goes through puberty, if they have a surge in testosterone, as often happens in assigned male at birth individuals, those vocal cords thicken. Once they have thickened, stopping testosterone and adding in estrogen does not change that in any way. So in order for an individual to have changes in their voice, they would require speech therapy, voice techniques, practice, that sort of thing, or alternatively intervention from an ENT surgeon in order to shave the vocal cords themselves.
Taking hormones wasn't a choice for me. It was a life and death situation. But I choose life. I choose happiness.
Well, I'm glad you did. But I want to know what are the risks involved with this medication though. I want to help you. I want to help other patients, but I do not want to risk any harm.
The risks that are normally associated, especially with estrogen therapy, would be like thrombosis or the blood clotting that can cause, cardiovascular or heart-related complications, especially in people who are smokers. So usually when we put patients on the estrogen therapy, we actually try and counsel the patient more towards stopping to smoke. And there's also mood and anxiety-related complications. So that's why we work very closely with the psychologists, to manage some of those effects.
Infertility generally occurs with trans women who are on hormone replacement therapy, but it's not a guarantee and it's difficult to put a time frame on it. It is usually regarded as being reversible in that if a trans woman is on HRT and becomes infertile, she should return to fertility if she stops the hormone replacement therapy, but recognizing that many trans women will be very reluctant to go off their hormones for a period of months in order to regain their fertility. Having said that, it's very important to remember that being on HRT is not a replacement for contraception.
Before a trans woman starts on hormones, she needs to think, do I want children one day? And if I do want children, do I want to save sperm in a sperm bank to then reproduce when you later on want to start a family?
Usually when you do the transition, for trans women, you want to keep the estrogen levels to be kind of the same level as a menstruating cisgender woman. So that's between about 400 to 600 picomoles per liter. So if you keep the estrogen levels around that level, the risks of developing those complications are well managed.
There are many people who self-medicate with birth control pills. The birth control pills contain ethinyl estradiol, which is not the safest estrogen. And when they still used that in the Netherlands for treating trans people, they found that there is a higher risk of deep vein thrombosis, which is a blood clot in your leg which can shoot up to your lungs and cause a pulmonary embolus, which can be very dangerous. People can even die from that. But if that is the only thing you have access to, it is what people are going to use. And I can't say, no, you can't transition and you can't use hormones and you must be dysphoric and desperately unhappy your whole life.
Transgender women do face hardships and unemployment, so we can't always afford these medications. Public hospitals do cater for us, but doctors and nurses do discriminate against us anyway. But with a little research, you can advise transgender women on everything, from appropriate hormone dosages to the safest tucking method.
What is tucking?
Tucking is when you take the penis and push it, to the back, and usually like using a tape of some sort, to stick it so that it doesn't come back, so to speak. The risks usually with tucking involve, the type of adhesive, that is used, and also like we tend to advise patients to like make sure that they are cleanly shaved when they do it, because that area becomes very, like when it's hairy and moist, there's increased risk of infections. And there's also a risk of infertility, like you do get, trans women who still want to be able to, to reproduce, so to speak. So when you push the scrotum to be closer to the body, there's warmth, like instead of the scrotum being in a cooler environment away from the body, which helps with the fertility, So, and I think another thing would be to make sure that the penis is flaccid, very flaccid when you do the tucking, because there's risk of penile fracture or injury.
Can we now talk about masculinizing, maybe?
Sure.